Welcome to the Indian Silicon Valley podcast. I'm your host, Jivraj, and today I have with me a very special guest. Join me in welcoming Sandeep Gupta, one of the co founders of Innovaccer, which is building one of the world's largest healthcare SaaS platforms. Thank you so much, Sandeep, for joining me. I'm incredibly delighted to be hosting you today.
No, absolutely. Been a pleasure when we heard that you are going to do this, and happy to be here. You can just refer me by Sandy. Sandeep is what my mom calls me. So Sandy would be
Yes.
good.
I'm going to do Sandy as we go ahead with the conversation, but it's phenomenal what Innovaccer has been able to achieve, and to think that there's an Indian team that primarily goes behind building this global healthcare product is mind blowing. And as we decode that, journey, I would like to first start with why healthcare, right? Because a lot of founders early on say that, okay, it's important to figure out a problem, but it's equally important to be deliberate about going after a large market opportunity, as they say, right? And healthcare perhaps is globally one of the largest markets out there. So if you can help us decode part of the early journey with emphasis on how deliberate you were to crack healthcare, considering the size of the market and the size of the opportunity, I think that would help a lot of budding entrepreneurs out there.
No, absolutely, absolutely. So it's been a very long journey, by the way. It's been just at a very high level, like 7 years, but it feels definitely been quite a while since we got started and everything. So just as a quick background about myself, engineer at heart, then went on to do my MBA, IIM Ahmedabad, post that working at this heavy engineering organization called Ingersoll Rand. That's where I met my co-founders. And from there, we got on and started Innovaccer. Innovaccer, when we started, it was more of a research collaboration between Harvard and Wharton. This was focused on those small, I would say, one-time kind of project gigs, but working with them is where we started working on these different kind of data problems and challenges that we had to deal with. We would work with bringing data from an unstructured format into a structured, standardized format so that all downstream analytics can really work on it. So it was extremely broad-based at the beginning, as you can see. And so this was a story way back in 2013 when we just started getting the taste of entrepreneurship after our corporate gig. All of us, all the all the key founders between Abhinav, Kanav, and myself. And so this is where we started working with the academia, working with the researchers. And post that, when we raised our first kind of angel round of funding, the feedback that we got was that, guys, you have built up something which is very incredible. Why don't you go into the industry rather than focusing on the academia? So we moved into that. And again, that was a good move at a very, very high level, because academia is great to build product, to learn, but again, you can't pay your bills. So even the parents started asking that, guys, what are you up to? We thought you had passed IIT, IIM and all those kind of things. Are you going to do something meaningful or not? So it was a welcome move back then, but we went again industry agnostic. We went with the same thesis. This was the year 2015. We went into a bunch of other kind of industries. It was finance, it was retail, it was entertainment. We had some very interesting customers right in the beginning in 2015. And these were like Harley Davidson, Disney, Walters Kluwer. But the biggest challenge that used to be that we were not able to focus in one specific area. And that's when we had to take a very, very hard and tough call of going and focusing just on healthcare. Now, I know that we will be focusing on separate aspects of this journey as we go into this discussion. But again, to answer your first question in terms of I would say that focusing on healthcare was more a serendipity in terms of that we came onto it rather than focusing into it, considering that none of the founders had healthcare as a background. And forget US healthcare, we did not even had a full understanding of the Indian healthcare ecosystem. We had to learn on the job pretty much. The only focus that we had a very good and deep understanding was the data aspect of it. So when the first problem that we got in healthcare, which was in 2015, which was working with our first customer, which is Catholic Health Initiatives, one of the large health systems in Midwest in the US, we jumped at it. We figured it out, and then gradually we delved deeper into into it. Right now, in hindsight, and even if I remember my IIM Ahmedabad days, I think they used to be all the business plans that when we used to make during our B plan days, right? It was used to be that, okay, find out the TAM of this market, and TAM used to be a very theoretical construct in terms of that. It is the total available market. So let's say if I'm launching even a given small solution at, let's say, $1 per person, India has got this entire population of billion. So if I get $1 or $2, it's like a huge TAM. And this is how the analysis used to be, right? I don't think that at least myself or even my team, we appreciated the value of TAM back in the day. However, today I can say that like being where we are today, and as we venture into some of the newer kind of areas and everything, I think the TAM is the single most important question as you start doing anything. And it's just not the TAM. TAM is just that the very theoretical large construct. After that, you have the SAM. SAM is the serviceable addressable market. And even further, there is the SOM, SOM, which is the serviceable obtainable market. Now, again, it again sounds very, very theoretical, but just to give you a sense, let's say if I was starting a restaurant right now in a couple of cities, right? And if I was to calculate my TAM now, it was, let's say, a fast food restaurant, right? So the TAM would be the fast food market, entire market across the world. Now that could be, let's say, $100 billion. So huge TAM, right? Now, if you look at the SAM, serviceable addressable market, you would say that I'm opening it up only in 2 cities. Now, suddenly from $100 billion, it drops down to, let's say, maybe I'm just making a number, let's say $10 million. Now, within that $10 million as well, you say how much is serviceable, obtainable, because you will have competition. It now reduces to maybe $10,000. So suddenly you have traversed a journey from $100 billion to $10,000. And having that understanding is so, so important, because as an entrepreneur, if you can't be brutally honest with yourself in terms of what is this obtainable market that you're going after, it will be a huge stumbling block down the line. And I have seen many of my kind of colleagues, friends from my engineering days and my MBA days falter on those steps. So it is better to put that effort and energy right in the beginning of starting your journey, rather than having to go back and redo everything that you spend time on. So again, just can't emphasize the importance of it. We got lucky when we got into healthcare. I don't think we understood it from that level of depth and detail, but that is a very kind of deliberate step for us as we go into any of the future undertakings that we want to do.
Got it. I think that's fascinating to hear, pretty much because I hear the words brutal honesty and a lot of awareness that one needs to have, especially in today's market, considering that a lot of innovation is taking place. And it's great how candid you've been in sharing that, initially it was serendipity, but now you are incredibly deliberate about it. So wonderful to hear, and a lot of food for thought. So thanks for that explanation, Sandy. I think going forward, what's also fascinating is I remembered from one of your past interviews, you mentioning that, the 3 co-founders took a one-way ticket to the US and started figuring out what's what. And you entered healthcare from a point of being a novice to now building incredible data products, an entire cloud platform for the US healthcare market, as well as now globally, right? Help us understand what it means to decode a new market and have that fresh perspective, right? Like we often hear, and it looks very good on Twitter to say that, okay, the beginner's mindset is important, disrupting a new industry is possible. But how did you do it practically to enter, which can rather look like a technical market, right? Because from the outside, healthcare seems technical. Help us just figure out, how did you, as beginners or as outsiders, figure out uncharted territory with healthcare, especially early on?
Sure. So it was not just healthcare. When we were again, the move that we had to make was that we were in India working with the research, and we took the harsh call of saying that, okay, you know what? We want to be, because see, there is a nuance, right? You can debase, and probably that nuance has changed a little because of COVID and everything, because now the world is much more closer to each other. So you can still sell, sitting out of India, a much larger product in the US. And I'll explain what large is. Back in the day, prior to COVID, the rough rule of thumb, at least what we used to consider, was that roughly if you have to sell a service worth $10,000 to $20,000 annually, you can sell it sitting out of India, or let's say anywhere. But if you have to sell anything which is increasing that, let's say $20,000 or more annually, you have to be in person. And it made sense, right? Because let's say if you're spending more than $20,000, it's like a high kind of high impact as well as high engagement sell, right? Let's say if you're going and purchasing a car worth, let's say 15 lakh rupees, or let's say $20,000, you will not purchase it over the call, right? So it made sense to be in person. So I think And that, by the way, has changed post COVID now because of everything. Traveling is banned and everything. But so the reason why, and 2015 was the time, 2014 actually, when we had to take this thing that, okay, you know what, let's move to the US and start doing it. And it was just not healthcare, it was across the board. And when we like made the decision, it was obviously a fairly like kind of a scary kind of a decision to make. I think the the only thing that was working in our favor was that we were just too young and foolish to know the practical risk that held. And the other thing was that only one of us was married out of the three. So, so much lesser liabilities kind of thing. So it was more about that. And it's not a liability, sorry, that word is wrong. It was more about that much lesser understanding of the responsibilities that we held. Because see, the point was that we could take any decision that we had to make, and it was more about that, okay, let's go ahead and figure out. So but it would be meaningless to say that it was not very, very scary when getting out over here. I still remember when the first travel I made, it was to New York, and I had just a couple of $100 with me in cash. And I took a taxi ride that took me $85 to land me at a Airbnb. I was like, dude, I spent 40% of the money that I brought in. And it used to be a very shoestrung kind of a budget on which we used to operate. Like, again, when we think about those days, it's not that back, right? It's just 6 years back. But when we think about those days sitting down today, it looks and feels to be impossible. Like, just to give you a sense, like our daily average kind of spend used to be $30-$35 a day. We would be crashing at our friend's place or somewhere in order to like figure it out, because again, it was entirely bootstrapped at that point in time and all those kind of things. So I think it was a very, very scary decision. It was, but the good part of that really was that we ended up being very close to our customers, right? So just to like from a focus perspective, it got us to focus on the things that really, really matter, remove all kind of zazz associated with it, and zero in on the problem statement of the customer. It kept us very, very agile, so that depending on what the customer was giving as a feedback, we could immediately transition. And we valued each and every dollar that not only we were earning, but also we were spending. So I think the fundamentals of the company got built up very strong, ground up back from those days at a very high level, Raj.
Got it. No, I think it's very heartening to hear how far the journey has come, and it's so nice to know the humble beginnings, right? And it's the distance that you've covered now. So kudos to the team for achieving that, and it's wonderful how you've disrupted the market. And I think now that we've covered some of the initial journey, I'd love to come to the platform by itself, right? At the core, Innovaccer seems like a data company that services and helps and builds products for multiple stakeholders down the healthcare chain, be it the doctors, patients, or healthcare providers. If you can help us decode how you use data as a mode, how you've looked at the entire problem statement, and maybe also provide context to those listening for the first time about Innovaccer as to what the model looks like and what some of the progressive technologies that Innovaccer has built. I think that would be super helpful from a context building standpoint.
So yeah, and again, so I'll explain about the data, and then I'll explain the business aspect of it from a healthcare point of view, right? So again, I'm sure that a lot of your listeners would have heard this, that data is the new oil. And again, this is not a statement from today. That's from late 2000s, I would say, at the earliest. Data scientists got that new kind of a terminology that was created, and everyone understood that because of the increasing kind of like decreasing storage cost and increasing compute power that is there, if you can like really like use the data which is up being created at every instance that we are living in this, like wherever we are, the data that is getting created, the learnings that can be generated from it can be super, super kind of transformational as you start using it for all downstream kind of, let's say, insights, application, behavior trends, and what have you. At a very, very high level. So, and again, over there, the data as a moat becomes such an important part as you're building the business, because whatever insights and analytics that you're generating from it helps every additional customer make so much more valuable insights. Then, let's say, from a new entrant point of view, you will have a challenge in generating. So, I think at the core of what we have built as an organization, the data has, and that's been the one consistent. So, we have made several pivots in our journey, right? We were the first pivot was we were working with academia. We went into industry agnostic. We then again pivoted. We went into healthcare. In healthcare as well, we again pivoted. We just went into providers. Now we are again kind of like branching out in terms of going to payers, life sciences, and all those kind of things. In this entire journey, we build up what we call as the Innovaccer Health Cloud. But the one consistent thematic that has been there in all our journey over the last 10 years is that the data ability to handle data from highly unstructured sources, bringing them all together, creating this unified patient record, and then helping downstream has been the one consistent thematic all across. So that is definitely a big kind of a moat. Now, from a business standpoint, the difference that happens is that, and US healthcare, again, depending on who your listeners are, US healthcare is very complex compared to our Indian ecosystem and some of the other places in the world as well. So there is one aspect, like again, US healthcare is advanced from a data standpoint compared to anywhere in the world, because you have all these EHRs, you at a patient visit, you record all of this information because you have to bill for that patient. But the big challenge is that there are so many data silos that end up getting created, because as a patient, I could go to hospital A, I could then go to clinic B, I could go to, let's say, a specialist C, and I could go to a laboratory D. Now, A, B, C, D are all different sources of data. And like that's one part of the problem, because even within A, you could have A1, A2, A3, because there are so many hospitals, because you could be in New York today, you could be in California tomorrow, you could be in Texas. Like, so this data gets so siloed and distributed that the first part of the problem is, can you just bring it in all together, create a unified patient record? Once you have created a unified patient record, now can you provide me insights around that on a predictive analytics base, that, okay, what is the risk of the patient? What does it look like in terms of future illness or some of the challenges that can come for the patient? And from a patient well-being, it's always a well-known kind of a fact that proactive care is always better than reactive care. Because if you get to the point of reactive care, the biggest point is that not only you are putting the patient's life at risk, or maybe giving them some severe kind of downtime from their active life, but more importantly, you are costing a major amount of money into the ecosystem. And that money would be borne by the patient, it will be borne by the employer, it would be borne by the system in general. So if you can, like, again, manage data well to start predicting all those kind of outcomes really well, then you, if you take a step back, you can have interventions whereby you can help improve the health of the patient as well. To give you an example, let's say if there's a diabetic, right? But if the diabetic patient, now you are measuring the HbA1c. Now, if let's say they are diabetic and they have not had a simple thing as a diabetic test done in the last 12 months, then something wrong is probably brewing up in terms of they may be not on the right medication, or maybe they are not doing all kind of controls that they should be doing. So if you can tell, looking at the data, that, okay, this person is diabetic, this is a high risk patient because maybe they are running hypertension as well, but they have not done a test, like at least recommend them to do a test immediately, because if they do a test, at least they will get a best insight and then they can go and see a doctor. So it's very simple, small things. I'm just giving a very simplified example, but they could be very complex thing as well, where you are trying to like really help the patient being taken care as one. And when I say care as one, that's one of the things that we profess with all our customers and all our stakeholders as well. Because again, there is the doctor, there is the nurse, there is a like MA staff. So all of them, along with the patient family, have to come together to ensure that the patient gets the best kind of treatment and the best kind of care at a very high level.
Got it. No, I think that's super helpful, especially because it lays down the importance of data, how you were able to foresee how it would play out as well, and then accordingly build products. And I think that's the wonderful connection, and the dots connect really well. So I think that explanation is very helpful context. But I think one of the foremost things that, let's say stems from there is developing empathy for the kind of stakeholders you have, considering that healthcare is one of the most sensitive industries out there, because you're directly in some shape or form interacting with the end consumer, which is the patient. How do you develop empathy, not just for the patient, but also for other healthcare providers? And how do you develop that within the team? And how has it been an evolving process? I think all of us would love to hear how that journey is played out.
Sure. And like, again, that is one of the things which is so important for any other budding entrepreneur as well. It really doesn't matter. Like, again, from our standpoint, when we back in 2014, we were looking at this problem. I think the most important thing that all the, like, it means at a founding team level and everyone that we aligned was that let's like understand the customer problem as much in depth as possible. At that point in time, the customer was maybe a financial analyst. It could be an IT analyst. It could be somebody who could be on the healthcare side. It could be on the entertainment side, as we defined that we were very broad based. So I think empathy at a core level should be there at a founder level in terms of how and like very closely you need to understand the customer problem. Now, there are some industry where as a user, you yourself understand the pain point and you can go about doing something to solve it. But in a large variety of those, you will probably not have the exact first-hand understanding of a sufficient large number of your customers and getting their feedback at a very high level that what is exactly the pain point. I think to develop the empathy, and what I was explaining earlier, that the scary move that we moved, like went to that, okay, move to the US to understand this, helped us like really quite a bit in terms of that, because we were so close to the customer, we could really understand their problems, their challenges, and we could pivot on the fly in terms of what was needed. There were times where we were really spending, and our first customer in healthcare, we were spending probably 18 hours in their office. And the story that goes over there is that this was in this small, like, again, this was not exactly small, but this was in the Midwest town of like Iowa. And over there in Des Moines, basically, so the state is Iowa and like in Des Moines. And over there, we were working at, I think at 2 a.m. in the night or something. And somebody called the police saying that, okay, there is somebody in the office in this hospital, something is wrong. And it was like really a funny situation. But what I'm trying to say is that working those 18 hours a day with the entire team, working in the IO, like in that hospital, figuring out the challenges, being very, very close to them, really helped us appreciate the problem and the challenges that the providers themselves go through. We worked, and like, again, we understood the problems of these providers, the caregivers firsthand in terms of what are the challenges that they face with their systems, the data. So once we appreciate, like we understood the appreciation for it, I think it became much easier for us to develop those products in terms of what could solve the customer pain point at the end of the day. Now, that being said, from 2016 onwards, we have made a very focused kind of an attempt to bring on a lot of clinicians onto the team. So at this point in time, there are numerous number of MDs or doctors, MBBS, like in India, kind of parallel MDs, MBBS, US, the same thing. After like the MDs or the specialists we bring on, we have a lot of RNs on the team. And again, the focus point is that as much as we can like really develop that empathy, that what the customer is facing. I think in this, the age old saying that the customer is king, try and understand as much as from them is so important that like it's worth its weight in gold, to say the least. But the customer centricity is what builds up the entire kind of like the empathy towards the challenges and the problems that they face.
Wonderful. I think lovely pointers to be echoed, because it emphasizes on the point that you have to stay close to the consumer, and there's no other way or shortcut to not having or not being customer centric. So I think wonderful points to be echoed. Moving further, Sandy, I think one of the core components of building Innovaccer has been having a very large and strong India team, for instance, right? And I think that builds the backbone of the company. And there's a lot of talent arbitrage that you've spoken about in the past as well. And I'm sure it brings a lot of joy for us to see a large group of Indians building these US healthcare products, and hopefully, I mean, soon for the world as well. Talk to us about how have you looked at talent management? What does it mean for you to expand upon, the much acclaimed build from India for the world statement, and how that flywheel has worked for Innovaccer in specific?
Sure. No, absolutely. I think like there are a lot of companies now in the India-US kind of a corridor that have worked really, really well. I think we were, and again, we think that we have been, I think, lucky enough, and as I explained, serendipity played a large part of it, but to develop one of the like large kind of SaaS product companies to come out of India. And again, the goal is to be the largest company in the vertical SaaS business that was ever there. So I think that's the goal that we have in front of ourselves to go and solve. And healthcare is that large market where we can accomplish that goal. So things and stars are aligning with God's grace accordingly. Now, India plays such an important part of it, because from a talent availability perspective, it is like great. I don't think there is any other place which will offer the same kind of talent. However, on the cost arbitrage point of view, that arbitrage has been decreasing. Like even from a 2010 perspective, when we were ourselves a pass out and like working out in the market, to let's say 2015 to where we are today, that arbitrage has been reducing. So like again, for a lot of companies focusing a lot more on kind of training and developing that talent is so important, because there is like, and I'm sure you would have heard this from all across the market, there is a crazy kind of run for the most kind of talented like folks that are there in the market, be that in the engineering area, be that in the GTM area. So how do you ensure that you are a talent magnet in terms of you have great culture, you have great kind of growth trajectory, as well as you are a great kind of training ground and a great kind of a launch pad for a lot of folks that come into the organization. I think that particular aspect of the last part of it is something that was like really aced by some of the IT giants that came in early or late 1990s and early 2000s, but something that the product SaaS companies have got a lot to learn from. And again, we are in that journey at this point in time, that how do you create that infrastructure and ecosystem that you can bring in that talent, kind of raw talent in, and then you can like really funnel them and bring them into a highly trained kind of a resource who can then be used into the product team, and you can use them either into the GTM team, or you can use them across the entire kind of the functional kind of a continuum as the requirement might be. So again, so some of those concepts over there in terms of but like again, arbitrage is a reducing concept for the folks as well. It's very important to an off repeated thing, right? To build your own skill set, bring your capabilities. As you build your capabilities, I think rest everything will anyways be a follow through that is bound to happen.
Got it. No, I think that's fair enough. And I remember you mentioning that it's less about the cost arbitrage, but it's more about the talent arbitrage, which is to say that the talent is incredibly wonderful and at par with any global level talent out there, which is something very heartening to hear. And we're hoping that more product companies come out of India and put us on the global SaaS map and global product map as well. So wonderful to hear that. I think moving forward, Sandy, to that point as well, another interesting aspect is building cross-border culture, right? And considering that we are now seeing a wave of remote first companies, decentralized teams coming in, I think Innovaccer for a long time has been structured in a way where a majority of the workforce is still based in India, along with, operations on the ground in the US. Talk to us about what building this cross-border culture means to Innovaccer. How have you been establishing it, and what did the transition in COVID look like? Because I'm guessing that it was a smoother transition considering that that norm was already there. But to hear from you as to how you've looked at building a global team from relatively day one, let's say, right? How has that journey been, and how have you looked at cross-border culture? I think that would be super fascinating to know.
No, absolutely. So see, culture plays the most important piece in terms of developing this. Like again, the folks that you are working with, they need to have a sense of ownership that you are trying to achieve something which is much bigger than the sum total of each one who is working on the team. So if there is that higher than like normal kind of a mission orientation in what you're trying to achieve, now that mission orientation could be that, okay, let's just build the largest company that is out there in the SaaS business, or let's build the product which is used across by 100 million people and have that sense of ownership, or let's build something which saves the life for X kind of people, or let's say it improves the quality of life of Y people. So I think those kind of mission orientation kind of statements are extremely important as a starting point. Now, once that is done, there has to be a cultural thematic that works across both the markets between the India-US corridor, so to say. So I think over there, we were blessed a little bit that in terms of we chose certain core values, which were so fundamental to like how at least at a founder level, like we used to think about the business just as a rough rule of thumb. So for example, the first one we talked about, that make your customer. So the customer centricity that we talked about, we called it up as make customers superheroes. The entire intent of making your customers superheroes was that if your customers win, And if they like really move forward, be that in terms of the well-being, or let's say in our case, our customers are the providers themselves. So it's not the end customer, which is the patient, it's the provider. So, but if you can make your provider's life so much better in terms of that, they can like maybe get the insights at the right point in time when the patient is in front of them. So making your customer superheroes was the first kind of major statement that connects all the two kind of pieces together, right? The second one then was that, okay, you know what, you need to take moonshots. And why this concept of moonshots is very important, that, okay, don't be okay with just okay. You have to like really take a moonshot, because again, if you are in a kind of a community, or if you are as a part of the team where everyone is trying to overachieve, that what keeps the best achievers together. If it is like a level playing field where everyone can just like achieve whatever is so baseline, then there is no point. So I think the second one is again very important, taking moonshots. The third one and the fourth one are kind of related in terms of like, okay, play and work as a team. And fourth one was that, okay, be empathetic to not only your customers, but also to your team members. Now, again, because of the cross border challenges and all those kind of things, and again, now we just don't have in India and US, we are also expanding into Middle East, we are there in the UK. So you will work with a global force. So until unless you have that team spirit kind of something, that until unless we work together as a group, we will not achieve that outcome we are looking for. As well as if you don't have that empathy for the person on the other side, in terms of that, you know what, maybe they don't understand healthcare, but they're still freaking like working their best to give you an outcome that works for everyone, right? So having empathy, working in the team. So that was our third and fourth kind of like the goals that we defined. And the last one was like really about that, okay, you know what, you really need to be transparent to your team members, right? Like if you, transparency is key. So I think like from a cultural standpoint, to help run this multi-societal, multicultural kind of global firm, I think being able to define those core values, something which is so important from a culture standpoint, has really helped us keep the team together, and also appreciate that what each and every one of us is doing in these kind of times that have been around. But I think culture is the only thing that like really binds and makes magic, so to say.
Absolutely. No, I think, again, very, very useful in terms of having and developing a framework to understand that there are some core competencies that you can have as a business, but to have them as a culture and a team, especially as a global one, is even more important, if almost similarly important. And the framework that you've laid down is very, very helpful. Wonderful. I think that covers a majority of the qualitative aspects of what I wanted to understand about the business, and I'm sure it gives the audience a lot of context to how to build a SaaS platform from India for the world in a niche industry. As we go forward to conclude the episode, I think a couple of final pointers on how you've compounded the business, and also a couple of personal ones. Then I think one of the core things that stands out about Innovaccer is the 100% year-on-year growth, reaching those revenue milestones, and the 100 million milestone that you set for yourself, becoming a $3.5 billion company in valuation, whatnot, right? Help us understand that as you scaled in the journey, and as a lot of young entrepreneurs watching, which are building out their businesses, what are some fundamentals that have stayed core to the business, and what do you attribute some of these scaling lessons to, right? If you can share any of those aspects, the more mature parts of the journey, I think that would be super helpful.
I was on mute, sorry. So on the scaling business and for the young entrepreneurs kind of setup as well, right? I think the first and the foremost thing is that you need to like really have a team that you can trust. Again, we have like, again, internally, we talk so much, like for the young entrepreneurs, the co-founders that you are choosing is probably the most important decision that you're going to make from the point of view of creating a business. And if not more, but at least it's at par with finding the right spouse for yourself. Let me put it that way. So it's so important. So getting a team in place at a co-founding level, as well as then your initial first employees, are going to make or break that kind of situation. The second thing that is then extremely important is that TAM, the SAM, and the SOM of the market you're going after. Now, again, I explained about that. So it's very, very important that you go after a very, very large market, right? Now, Now, whichever market that you're trying to sell to, you have to be, as an entrepreneur, the first seller for your company selling into that market. There is an old saying in Hindi, right? And if I can use that, it goes on like this: that okay, apne mare bina swarg nahi milta, kind of thing, right? So you cannot like really get where you want to be by hoping that you will just hire a couple of sellers and hire and like put them somewhere and they will figure out. I have seen so many times there's the same mistake being done, that okay, you will not get your hands dirty, you are sitting in some other geography and hoping that okay, the sellers will figure it out. They will not. And again, despite their best intents, it's not that they're trying to fool you or they're not trying to give you the best outcome. It is just that as an entrepreneur, this is your job, this is your 101, that you are supposed to do it yourself. So please be as close to your customer, be the first seller of your own company. If you cannot sell your own vision and your own company, trust me, nobody else will be able to. So that's the third thing which would be there. And then as you go along, establishing that product market fit. And when I say product market fit, you could have a huge product kind of an idea that okay, I'll do this, I'll do that, but if the market is not paying for it and it's not even a problem, then why build it? So don't fall into the challenge of a builder's dilemma, or like getting too much in love with your own product when nobody is ready to buy. So you should be very agile on your feet, so to say, so that you can immediately transition as and when the requirement is. And product market fit, being extremely close to the customer, kind of the third and fourth kind of gel into the same kind of a thing. Now, and again, the easiest piece over there is that, again, I've heard from a lot of like, again, my colleagues and entrepreneurs that, okay, the reason why they get into entrepreneurship is that they don't want to be, what was the statement? They say that, okay, you want to be your own boss. Kind of a thing. But that's one of the biggest misconception about entrepreneurship. If you end up being in this, you will be like the last boss you would ever think about, in terms of everyone else becomes your boss. It will be your employees, it will be your co-founders, it will be your customers. So do it for the right reasons at a very, very high level. So that would be like the thing for the young entrepreneurs that are there, or whoever is evaluating. On the Innovaccer side, again, with those things now as a hygiene factor taken care of. So we have been lucky that we have established that. I think we are growing fairly comfortably at the rate. And again, but it's comfort is one point of it. But again, growing at now that huge pace, at a significant base at which we are, gets very, very challenging. So again, getting into newer areas, newer solutions, newer products is the challenge that any company of our scale and size faces, and which we are as well at this point in time. The focus and the goal is to be that $1 billion revenue company in the next 5 to 7 years is what we are gunning after. And again, if we can do that, we'll probably be one of the largest kind of SaaS company to have been built in this area. And again, like now we are focused not only in the US, we are focusing into Europe, we are focusing into UAE. So this is a global problem that we can solve at scale. So again, SAM is huge that we are going after. The team is great. So again, it's a very challenging road ahead yet, as is for any kind of setup. But again, there's a lot of confidence. In 6 years time frame, we have been able to get to that $100 million mark, so to say, from 0 to 100, so to say. So there is that, in cars analogy you see, right, where you get from 0 to 60 or 0 to 100 kilometers per hour in 6 seconds, or whatever that thing is. In us, at least 0 to 100 we have accomplished in a matter of 6 years. So that's one thing of pride for us. But there is still a long way to go. We are still at 10% of where we want to be. So yeah, onwards and upwards.
Absolutely, always the motto, and lovely to hear the qualitative aspects of what you mentioned are important factors to note for entrepreneurs, and how you've looked at the journey. And I'm sure we're all hopeful that the $1 billion mark is not that far away, and that we're going to achieve it very soon. We're going to see Innovaccer be there. I think the other aspect, before we move on to personal questions, is you've been able to, Innovaccer as an organization has been able to crack US GTM, in a very, very primary aspect, given that that's the forefront and the core market. Can you help us decode, because a lot of young entrepreneurs face this challenge, that as you build global products, what's the GTM strategy going to be? Given that you sold to large enterprises now for a considerable amount of time at scale, any cues there in terms of just GTM strategies or selling to large enterprises would be super helpful, Sandy.
No, absolutely. And it's been, again, one of the very fun-filled kind of a journey, to say the least. And as a 25-year-old something, walking into a kind of these behemoths, Fortune 100, Fortune 10 organizations with that kind of confidence that, yes, you know what, I can solve this problem for you, definitely took a lot of guts. As I said, that maybe it was some foolishness on our part, not knowing how large those organizations were. But it's been one very interesting journey. The most important aspect of that is that please, as an entrepreneur, be at the forefront of the selling yourself. Don't like, again, you have to do it yourself kind of thing, because then the important piece is that when you are talking to customers, you will get so many incredible ideas that you need to pivot at the same point when they are talking to you. So you have to be having that capability, and you need to be like able to walk step in step with a customer. If they talk about a problem and you immediately say, can we do this, will it solve, okay, can we do this? So that dialogue that happens with them, especially in that B2B enterprise business. And again, for us, we were working with pretty much the top of the pyramid kind of customers, right? In terms of like working like with customers where our average deal size is probably like $1 million to $5 million on an annual kind of a basis. So when you're working with them, or like that expectation has been set up, being able to interact with them in that kind of a real-time manner is extremely, extremely important. Number one. Number two, that then ends up being is that when you are yourself doing it and you are right over there, your initial first few customers are also extremely important, because they help you shape up so think of it like a discussion that is happening between a customer and the kind of partner, right? Or the company, basically. So two of them discussing. Now the customer comes up with an idea. As the kind of provider, at the service provider or the product company, you have to say that, okay, is that idea now scalable? Can I take it to 100 places? At the same point in time, you have to service a given customer, so that you don't end up becoming just another service IT organization. So I think with those guardrails in place, getting the first customers that can marry in that vision and then scaling up becomes important. And then like what you learn from the customer, kind of abstracting the most important aspects of it, which can then be made into a repeatable cookie cutter solution that now your team can take and start selling into the market, makes like really a scalable and a successful GTM. This entire process is what we call as a product market fitment kind of an exercise, that, okay, go ahead, find that fitment. And if that's happening, you just start scaling up. And yeah, so again, it's like, it is the hardest part of the journey, but once it is established, then the scale comes naturally attached to it.
Wonderful. I think, again, very, very helpful. And thanks for sharing that. I think moving to some of the closing pointers, and these are a set of similar questions that I ask founders to decode their personal journeys. But I think one of the core things that I realized from my research on you was punching above your weight was one of those, core themes that you've carried forward through the Innovaccer journey personally. And it just shows. You mentioned it in brief earlier in one of the company values, but if you can talk about what that means and how you've been able to practice that over time and how that phase has evolved for you through the journey, I think I personally would love to hear that. And I'm sure it's going to be super helpful for everyone else.
No, absolutely. I think that's the specific trait that we call in one of the 5 traits that we have in the organization from a cultural standpoint. It is taking moonshots. And taking moonshots is like really being able to punch above what you feel you are capable of yourself. And again, the value of it is to prove to yourself that, yes, you can, do so much more. And just to give you an example, when we were back in India, we had not made any sale in the enterprise markets in the India setup, like saying that, okay, we'll do it in the US. Within the US as well, going to some of the largest kind of organizations that anyone and everyone would have said that, okay, you know what, it's a thing that only for 40, 50-year-old folks who have the experience to do it, as 25 years old, being able to do it. Then again, iterating on the product, delivering on it. So I think taking moonshots and being able to punch above your weight class, so to say, is so important. And at the same point in time, being extremely, extremely humble about it. I think there is one class of entrepreneurship which of late has come up that is being about zazzy, flashy, and it's a rock star kind of a culture. I think at Innovaccer, we think just the opposite side of it. And at least at a co-founder level amongst us, it's a very humble kind of beginning as to how we think about it. We again are extremely, extremely grateful to our customers, to all our employees who work with us, around the founding team members. I think we are in it to like achieve one thing which is very important to create a lasting impact as an organization and solving this real problem that we are after. And that's what keeps us all together. And as we like in this journey want to create this bigger than self or bigger than all of us combined together kind of an organization that can stand the test of time, be worth in terms of revenue more than a specific number which I just quoted in $1 billion or something, but that's at the core of it. So I think all of this, when comes in together, is where like something special or some magic ends up getting created.
Absolutely. I think a very, very important pointer, and lovely to have that echoed. Moving forward, again, I feel that very often we talk about company scaling, and this is one of my foremost favorite questions on the podcast. We talk about company scaling, but not about founder scaling. Can you help us establish how you personally have scaled through this journey, right? While it has been 6 years, as you were saying, it feels like a lot of time because so much has gone and so much value has been created more so. How have you transformed through this journey? What was Sandy like in 2015 to what Sandy is like now? If you can give us a quick overview of what entrepreneurship has done to you personally, I think that would be fabulous to hear.
No, absolutely. I think you grow so much as an individual because you start understanding so much of different perspectives to the same challenges that are there. I kind of become the end point of a lot of challenges that come up. So you start appreciating the fact that just highlighting the challenges are not sufficient, but understanding the solution or coming up with a solution is as much as important. And when you come up with a solution, then like again, brainstorming, because if you hire the best, those folks and everyone on the team is going to be better than you. Then how can you like really have a discussion in terms of that everyone is trying to contribute in a kind of like a great teamwork kind of a setup, having that empathy as a part of it, and ensuring that the power is in the point that you are making rather than just a deck that has been thrown out or a PowerPoint that has been created, ends up being extremely, extremely important. So I think the more that we have gone through this journey, at least at an individual, the humility has increased in terms of what like and how much help have we sought not only from the teams that we are working with, but also with the customers that are there. So that appreciation is there. The perspective that we have gained is great as well. On the physical side, I did not used to have a goatee, but I had to put this on as I was selling in the market because otherwise I was considered as a kid in front of them. Now, at least with a goatee in 2015, I used to like, okay, he's not a 25, maybe he's a 35 something. So that used to help me sell. But jokes aside, I think great journey nevertheless.
Absolutely. We can only imagine, and it's wonderful how far it's come and still sticking to the core values that define you. And that's my next question, in fact, for the second last or some of the last questions. What are some values and principles that you perhaps live by? I think that defines a person at its core. And if you can just expand upon some qualitative traits that drive you as an individual, I think that would be really helpful.
Yeah, I think on the qualitative side, as I said, right, like so like building up something which stands the test of time and something that you can really be proud of, so that even when, let's say, and again, that gets a little bit on the kind of what drive that keeps that even when you are not there, kind of a setup continues to run. So it should not be kind of a setup that, okay, you know what, it is great. So it is not who you are. Again, you will have a lot of cultural traits that the company will accordingly function and like help imbibe. But let's say even after, like if it is like really something to be proud of that you have built off, it should continue even like if you are removed, if you are not there, whatever those challenges are. Now the company needs to stand on its own. So I think that realization is very core amongst all the like the co-founders and the founding team members, that we want to build something which goes on for a very long time. And again, while we do that, being able to do something more than what we are capable of and being extremely humble about it. So I think all in all, those are the key kind of components that bring us all together. It again like sounds the same kind of thing, but when you put it to practice is where I think it really starts creating that kind of a compounding effect from a downstream perspective.
Got it. Fair enough. I think phenomenal ambition there. And I think everybody dreams of building an institution that outlives them. And to hear that in person is just wonderful. And I'm sure Innovaccer is in that trajectory. Sandy, this has been wonderful. And I don't know what would be a fitting end to a great conversation, but two parts. One is that if you can, share your thoughts around how the future of healthcare looks like, especially considering that you have a forefront view of how things are evolving because they're moving to proactive care. And also now that you're building this product company in vertical SaaS, which is incredibly huge, and a lot of young entrepreneurs look up to the Innovaccer journey. If you have anything to tell them as a final word, and how you've looked at the journey and building this large company from India for the world, I think if you can elaborate on both of those pointers as closing thoughts, I think it would be a great summarization of a wonderful conversation.
No, absolutely. I think for all the entrepreneurs, see, the point is that it will feel scary, but get into it for the right reasons in terms of that you're really trying to solve the problems. Don't get into it because of the SaaS, because SaaS will die out very fast. It will die out in 3 months, 6 months. Only 1% of the startups survive, maybe 5%. But again, it's gotten easier to now get into entrepreneurship because everyone looks up to that segment. But it's like that one headline that you will get in some kind of publication saying that, okay, you release this or you got some kind of like initial round of funding. It is like a very heavy grit work. That being said, so get into it with the right reasons in place. Put your kind of head down in terms of the goal and the outcomes that you want to achieve. Build a great team, because when the things get tough, it is the team that is going to help you through. And that is why one of my advice to all other entrepreneurs is that, guys, it sounds great to be the only founder in a given company, but please try and get a co-founders as well, because when going gets tough, the co-founders and the founding team members are what are going to keep you together, because that vision, unless it's a shared vision, it is not going to get successful. So again, those part become extremely important. Figure out a market which is large enough in terms of what you're trying to achieve. Once you have done that, again, have the thesis of the product DNA in place, that what can be sold in one place, you can now repeat it and send it at 1,000 other places, and then go about establishing the product market fit with yourself being the first seller or the first kind of like person who is on the ground trying to figure out what best to do. It sounds like, again, very challenging at times, but if you put your heart, mind, and soul to it, you will find your pot of gold, so to say, at some point in time. It will be round the corner. Just keep working hard at it with the right kind of team and the fundamentals in place. Sooner or later, it will come your way. If there is, and in our case, the thing was, there was no plan B. The plan A was that, okay, we are going to do this. We are going to make it successful. If there was a plan B, we would have probably gone to plan B at some point in time, because there are going to be troughs that are going to come your way. I think if as a team, you have that motivation because you enjoy working together and you are in this journey together where you are trying to establish the product market fit, you will find it. You will find your pot of gold, so to say. And then once you find it, then it's a scaling challenge that you will all get onto it together. But if like I have to like think back in any of those kind of things, I don't think that anything I would redo, even if I had to do it a second time. It's just about getting the fundamentals in place and then just be at it.
Awesome. I think that's phenomenal to hear, and a great end to a wonderful conversation. I've personally taken back a lot of fundamentals to company building, and personally as well, considering that you've candidly spoken about the challenges of entrepreneurship and getting into it for the right reasons, not just because of the glamour that comes along with it, which is of course a later part of a journey, which is has a lot of grades. So I think thank you so much for being your candid self, Sandy. I have personally learned a lot, and I'm sure everyone listening in will have a wonderful time grasping all the learnings. I hope you enjoyed the conversation, and I had a good time as well.
No, this was great. And yeah, look forward to being back sometime, Jiran.
Thank you so much, Sandy. This means a lot.